driving between Lake Carlos and La Jometer there. And I remember she looked at me as it opened up into both lakes and said, if you don't want to look anymore, we don't have to. So they offered us a job that night, and that's where we ended up. So we've been here for 8 years. We've started both our young daughters in school here, and we've been a part of the community, and we're real pleased to be here. So today I'm going to give a talk on bone health and fracture prevention. This is the first time I've given this talk in particular, so it's going to be quite informal. And by that I mean any questions that come up, just feel free to ask stop me midstream and I'll answer them, okay? So this here is the group of doctors that I work with here at Heartland Orthopedics. I think there's a card for each of them out on the front table there. There are many different places to do orthopedics and to be a doctor and practice orthopedics. And my wife, like I said, you know, being an Air Force kid moving around, sometimes she gets itchy feet. And I said, well, I could practice orthopedics anywhere, but I would never have the other guys here that I work with. And it is this group of guys here that I think are not great people, which they are, but I think they're also some of the best surgeons that I've ever met. And I mean that through all of my training, going through Hennepin County, the University of Minnesota, the VA Medical Center. If they had just plopped me down here day one of residency, I'd have been an even better doctor coming out, because I work with the greatest guys ever. So what we're going to talk about today is bones, and in particular osteoporosis, and kind of define what osteoporosis means and what it means for us as individuals as we get older. A hip fracture, that's one of the things that we talk about, which very frequently is associated with osteoporosis or weakening of the bone itself. We'll talk about some of the tests that can be involved and how we diagnose osteoporosis, and some of the things that we do medically in order to try to prevent it or try to delay its onset, and also what we have to do in response to if people would happen to have a broken bone as a consequence of their osteoporosis. So the human body has 206 different bones. And I don't know that I ever knew that when I started my medical school or at my training. My dad was a general surgeon. He trained at the University of Minnesota. I'm sorry, the Mayo Clinic. And I always thought I'm going to be a general surgeon. And it took me one day of grand rounds at the University of Minnesota to say I'm never going to be a general surgeon. But I always knew I wanted to be a surgeon. And it just so happened that the second rotation I ever took was in orthopedics. And it just stuck with me all throughout there. And that was the thing that interested me. So 206 bones in the human skeleton. And bones are fantastic things. Not only do they provide our skeletal support, but they provide protection for our heart. They provide protection for our lungs. They serve as the whole fabric and structure on which we can propel ourselves and move around. The bones also play a huge part in just who we are as people, because within the center of bones, you have the red marrow and the yellow marrow. And those are the blood cells, which help to give us the red blood cells that help to circulate our oxygen to all of our tissue. Well, they don't circulate, they make the blood cells. The heart, lungs oxygenate it and push it through. And then also all of the cells that help us to fight infection. And so the bones are not just organs to provide a structure. They have a multiple and diverse function. In the adult, the skeleton comprises about 14% of our total body weight. And even though bones are hard and solid and you think of them as not being comprised of water, half of their weight is made up of water. And as I said, the blood cells produce both, or the bone and the canals, the cavities of the bone, produce both the red and the white blood cells and store different minerals. So the bone itself has calcium and phosphate and different minerals that we take, and the body sends different chemicals out to the bones, and you can actually use the bones as a source of different minerals in times when your body might be depleted and so forth. So the bones really do provide a great purpose. Now this is just an example, kind of a schematic of bone. On the outside, at the end of bone, say at the upper part of your shoulder where the ball meets the socket, or the hip joint where the ball meets the socket, or the knees where the two ends of the bones come together, there's a protective layer of cartilage. And what that cartilage does is it provides a smooth, gliding surface for pain-free range of motion of the joints themselves. Underneath the cartilage here is a very hard shell of bone. And underneath that hard shell of bone is basically what we call spongy bone or trabecular bone. And that really is kind of what it looks like inside. When we talk about spongy bone, just think of it as a sponge. As we get into the talk a little bit more, and we start talking about osteoporosis and porosity of bone, porosity meaning kind of holes in the bone, this spongy bone here actually becomes thinner and thinner, and those holes become bigger and bigger, and that you can tell is the weakening of the bone, and you can see that at the time of surgery. Now, one thing, just as a caveat, I work a lot with patients with arthritis and doing hip and knee replacements. What arthritis is by definition is when the cartilage that covers the end of the bone starts to wear away and you lose that cartilage cap that protects the bone. It's the underlying exposed bone here that is by definition arthritis. And so cartilage has very few pain receptors. So when you have a normal functioning joint, there's no pain with the range of motion and the bone or the cartilage ends of the bones touching each other. When you lose this protective cartilage and you have bone scraping on bone, bone has a high concentration of nerve endings, and that's what causes the ache and pain associated with arthritis. So within the cavities of the bones here, this is where you have bone marrow, and you produce the cells that make red blood cells, as well as the cells that are important in modulating against infection and so forth. Now, osteoporosis is also known as porous bone, okay, and it is a decrease in the bone mass overall. And probably the best way to think about this is to think of a sponge. You have a sponge where you can have a sponge where the holes are really tight and close together, or you can have another type of sponge. Maybe you have one in your shower, a Lusa sponge or whatever, and they have large holes. And that increased hole, that's the porosity of that. And that's kind of how bone functions too. When we're younger and our bones are stronger, you have kind of a tighter knit of the bones themselves, a tighter sponge. But then as we get older, certain physiologic and age-related factors can lead to weakening of the bone or increased porosity of the bone, and that's what's called osteoporosis. Now, what is the significance of osteoporosis? Well, in orthopedics and just in general, in the population, it is very significantly associated with injuries and things like that people can sustain. And it's part of my practice very much, and a part of the practice of all of my partners here. Osteoporosis is a condition that both men and women get, but women are more prone to that. And when you're over 50 years old, you have a higher risk of osteoporosis, and in particular postmenopausal women. That's a baby that was born, so that's going to be good bone coming out. Osteoporosis affects about 40 million Americans, and it's estimated that 1.5 to 2 million fractures or broken bones occur each year in association with osteoporosis or weakening porosity of the bone. Other effects associated with osteoporosis, in addition to broken bones, can include a loss of height. That can be the vertebrae that help to maintain your posture. As the bone weakens, it can kind of collapse a little bit. And you can get fractures or broken bones, and that actually does come about with an appreciable loss of people's height. It can be resulted in restricted mobility with broken bones around the hip or the wrists, or a hunched back. That's also kind of associated with kyphosis or conditions associated with the osteoporosis.
I have a question.
Yes, ma'am.
Okay, if the bones are 14% of your weight and half of that is water,
Yeah.
if a person is frequently dehydrated, does that weaken the bones?
No, I don't think so.
Oh.
No. Yeah. Your body wants to maintain a homeostasis. So what it's going to do is it's going to try to distribute and take that water and that water that you have stored and distribute it to the areas that are necessary. As far as the bone as a reservoir or a deposit, I said how you can take minerals or in and out of bones. I don't think that's quite the same with the water itself. Okay, for the bone as a repository. It's estimated that by 2015, 19 million individuals will be 85 years or older. Now, what's the significance of that? There'll be a lot more people with weaker bone, and a lot more people that will potentially be susceptible to having broken bones as a result of that. and it's not insignificant. Broken bones are very frequent, and we have broken bones of the vertebrae or the spine. That makes up 27% or so, over a quarter of osteoporotic related fractures. At Heartland Orthopedics, we don't take care of the spine per se, but we do take care of these other ones. Wrist fractures, almost 20%, hip fractures, 14%, pelvis fractures, 7%, and other broken bones, 33%. I was on call this weekend, so Friday, Saturday, and Sunday. I took care of 3 hip fractures, and I took care of a pelvis fracture, and I also took care of one of these and the other, and all of them were related to weakening of the bone. Okay, so even just in a small community such as Alexandria, this is worldwide, and it affects many of the people that we know. Now, risk factors, women are most significantly affected. Now, the way I generally think about it, when I think of osteoporosis, we're kind of in a good setup right here, because you usually think of women, thin women, Caucasian women, so when you're white you have a higher disposition to that. People that have had a lack of calcium or good nutrition and vitamin D. In Minnesota, where we don't see the sun quite as much during the year, vitamin D is a product that our skin helps produce vitamin D upon exposure to the sun. And so that in this type of climate, we have vitamin D deficiencies not infrequently. Cigarette smoking, excessive alcohol use. Some people are on extended steroid medicine because of pain or other issues that they might have. And all of these can be associated with the development of osteoporosis. So of the things that we can affect, there are things we can and we can't change. Things we can't change are what sex we are when we're born, our family history, or our age. We're going to get older. But we can change and modify different things. And this is how our medical treatment generally is directed, for maintaining an appropriate calcium and vitamin D, maintaining a good exercise program. It's not just heart and lungs. When we're talking about osteoporosis, it doesn't just mean, well, I work out all the time and I ride my bike and I've got good lung and good heart function. For osteoporosis, to try to minimize that, you want to have a good weightlifting or resistance type program. So strengthening exercises have been determined to be more impressive in helping prevent or minimize the effects of osteoporosis as opposed to simple aerobic conditioning. So when older Americans get their first osteoporotic fracture, they're also susceptible. That kind of gives us an idea that they may be susceptible to having additional fractures related to that. And I would say that in my own practice and in my partner's practice here, it's not uncommon to take care of someone that maybe had a fall that resulted in a wrist fracture, and then get to meet them again another year or maybe a couple years later, where they've fallen and maybe broken another wrist, or maybe broken their hip or something like that. So not uncommon at all. And the significance of this, not only because it hurts to break a bone, not only because it affects people's lives and significantly can, be detrimental for people, but just on a societal thing. Many hospitalizations per year for osteoporotic or fragility fractures. Costs $2.5 million office visits per year. Many different nursing home admissions, and the cost just in osteoporosis itself, over $17 million in trying to take care of the sequelae associated with it.
Going back one frame.
Yeah.
The extended use of corticosteroids.
Yeah.
When your knee or another joint is injected, then
Yeah.
is this counterproductive? I mean, it's relieving you of pain,
Yeah.
but is it
Different for that.
Pardon?
That's different for that. That's a very good question. So with, lots of times when people have ache, pain, and discomfort in their joints, their orthopedic doctor says, well, let's give you a cortisone shot. And there are many people that say, boy, I've heard lots of things about cortisone shots. Maybe it's not so good for me for the long term. There is a difference between the shots which go directly into a joint, where it tends to be more joint related, it stays within the joint there. Whereas corticosteroids here, this would be more systemic. And what I mean by that is pills that you take by mouth, which they can help your knee pain, but it goes everywhere else. And excessive use of that can ultimately potentially lead to problems with the bone. I just saw a wonderful patient just a few weeks ago who came in with knee pain. And you look at the x-rays and you say, boy, it really looks okay. But one of the parts of the history that they had was that they'd been on chronic steroid use taken by mouth for rheumatoid arthritis that they had. And even though the x-rays looked pretty good, I did get another study, an MRI, and it showed really the terrible osteoporosis and small little what we call fragility fractures within the bone related to that. So I guess in short, sir, the shots that you get are generally localized just to the hip, just to the knee, and don't cause that systemic weakening of the bone like you can get with long-term oral medicines.
Can the shots be abused?
Can the shots be
Not
abused?
abused, but over.
Yep, I think they can. So if you have a joint that looks pretty good, okay, and at the beginning I talked about arthritis being, by definition, a loss of cartilage. Well, there are different degrees. When someone says, well, I have arthritis of my knee, well, does that mean you have a little bit of arthritis, kind of middle of the road arthritis, or a whole lot of arthritis? A whole lot of arthritis means you really have no cartilage remaining. When you have a little bit of arthritis, you have some ache and pain, but you still have cartilage remaining. And so for the person that has severe arthritis, I'll give cortisone shots as long as they help to decrease people's ache and pain. And I give them about every 3 months or so if necessary. For someone that still has reasonable cartilage remaining there, I won't give too many shots of cortisone because the cortisone can actually break up some of the cartilage that's there. Not so much weakening of the bone in that instance, but more it can actually facilitate the rate or the speed up of osteoarthritis. So, yes, sir.
In addition to cardiovascular, so we should kind of work on exercise for strength.
Yep.
What's the recommendation at home that you can work on strength?
Well, just like a barbell type of thing, with the hand dumbbells or small presses and things like that with a barbell. Those are very good. It doesn't have to be, you don't have to become Arnold Schwarzenegger, and you don't have to say, I'm the most buff guy on the block. Just anything that offers resistance training. And by resistance training, you have to, it's not like an exercise bike, for example. You can get on there and dial it to 0, and then you just keep going around and no problem. You can dial up the pound or the resistance that you get, and that will increase the strength or the resistance. That's the same with barbells. You don't necessarily have to be lifting a 50-pound barbell to get the beneficial effects, but a 10-pound barbell, repeatedly can offer substantial improvements as well. So hip fractures, I took care of a couple of these this weekend. Now, almost all of us know someone that has a hip fracture. And we know that, well, my son or my grandmother had a hip fracture and they had a hip replacement for it. Or someone else had a hip fracture, well, they had a plate with screws. Or another one has a hip fracture and, well, they just got screws. Where was the plate? And so there are many different types of hip fractures or different patterns in which the hip can break. And that's why they send us to orthopedic school for all those years, so we can identify and hopefully choose the right case. But x-rays of the affected hip are necessary when you have a hip fracture. A pathologic fracture just means, in the setting of osteoporosis, just means that the bone isn't normal. The bone is osteoporotic or has that condition, and that can facilitate or lead to a broken bone like this. The bone can break in the femoral head, which is the ball. It can break in the neck, which is right along here where part of this is. It can break in the subtrochanteric region, which is below this little piece that is broken off there, or intertrochanteric between here. So this would be a comminuted, unstable intertrochanteric femur fracture. So this is one of the two that I fixed this weekend. So here's an example of a sliding hip screw with the plate, which we talked about. Here's an example of just the 2 screws. You can see that these 2 screws right here are fixing a crack that goes through the femoral neck there. You can kind of see this little jagged displacement of bone. This right here, this type of broken bone came down through this way, and this one's already healed, so it looks really good. Hip fracture treatment, there are risks with anything in life, and I tell patients there are risks with surgery. Risks of bleeding, infection, injury to blood vessels or nerves, blood clots, anesthesia problems. People can die from surgery. The risks without doing surgery are oftentimes the same. Risk of blood clots, confusion, increased risk of pulmonary or lung complications. And so that's where orthopedics comes in. Oftentimes the broken bones, our goal is to get people fixed as soon as we can, so that we can get them up and out of bed or at least into a chair, so that we can minimize the associated risks of having broken the bone. At Douglas County Hospital, I guess in 2014, we fixed 87 hip fractures. So you can imagine that that's, 1.5 probably a week almost. Some weeks I would guess that there probably isn't much of a week where we ever get 0. But I would guess that sometimes we get, 3 or 4 in a week, and it all kind of depends. So, screening, as far as how do we test for osteoporosis? Well, one of the tests we do is we just look at a bone mineral density, and we use what's called a DEXA scan, or a dual energy X-ray absorptiometry. So what we're basically looking at with that is to see that sponge analogy that we used at the beginning. How thick or how dense is the sponge? Okay, and the DEXA scan is useful to try to tell us just how dense that sponge is and what degree of osteoporosis people might have. So prevention, strategies for maintaining strong bones. Well, we've talked about, calcium and vitamin D being 2 things which are important for people. So calcium, the daily recommended dose for calcium is generally 1,200 milligrams of calcium per day. Vitamin D, it's generally on the order of what we call 400 to 800 international units of vitamin D per day. Now, people say, well, I'm not going to remember these numbers. If you go to your local pharmacy or supermarket in the health and nutrition section, you generally see they come in that kind of dosage. Generally, for the calcium, they generally come in about 400 milligram pills with 200 milligrams of international units of vitamin D. So you take that a couple times a day, and then that can avoid some of the side effects associated with taking it too much at once, but also provides you appropriate supplementation for it. Now, do you need to go and supplement your diet? If you're taking appropriate, eating calcium such as milk or yogurt or cheese or different things like that, you don't have to go out and supplement it with an additional 1,200 milligrams, of supplement, but you do kind of want to maintain that idea of 1,200 milligrams of calcium per day. If you can't tolerate dairy products, well, there's a million ways to get calcium. You can get them in energy drinks and everything else like that. Regular weight-bearing exercises, keeping your aerobic health obviously is very important, but we did add that the resistance and strength training also was an important part to try to ameliorate or decrease the risk of osteoporosis. There are many different medications which can be used. Sally Field, you used to see her on TV saying get Boniva and different things that you can get as supplements or medications actually in an effort to try to attenuate or improve the density of the bone itself in conditions such as osteoporosis. Most calcium and vitamin D supplements are available over the counter. Talking to your primary care physician, the reason we put this in as a caveat is some people actually have conditions where too much calcium can cause things like kidney stones or different things like that. So anytime you want to make kind of a fundamental change to your overall health and you're going to add something new, even though these supplements are over the counter, they still are considered kind of medications for people. So it is something to consider. So these are some links that are available to look up all this stuff. Just type in osteoporosis and Google will get you what you need. So that's pretty much it.
I had a question.
Yes, sir.
On one of your charts, you said 25% of the people that have a hip replacement die within a year. Is that because they're older?
I kind of skimmed through that, didn't I?
Yes, you did.
This is to be all uplifting today. So, hip fractures are pretty devastating for people. And, it's not infrequent that people will come in and say, I've had a hip fracture. Well, what they want to know is, one, that they have a doctor that can try to help them. And two, they want to know, when can I go back to living the life that I want to live? Statistically, 2/3 of people that have a hip fracture will not regain their functional ability the way that they had prior to breaking the hip. Okay, so walking distance or walking without a gait or an assist device, 2/3 of patients really don't get back to that same level of activity. With regard to mortality, death, 30% of people that have a hip fracture will die within the first 3 months of having had it. That's kind of a statistical kind of thing. And up to a year, did it say 25%? If you can survive that first year after your hip fracture, then you get back on the curve with everybody else that's your age. But in the first 3 months, that's when you have up to a 30% morbidity associated with that. Oftentimes, hip fractures, we talk about it, it's nice and easy to say, well, if you get weak bones, you have a risk of breaking your hip. Oftentimes, these hip fractures in the patients that we see, they don't really fit into a nice little, package that you can say. Oftentimes, a hip fracture isn't the cause of the problem, it's oftentimes the secondary cause. Confusion as we get older, overall weakness, different medical issues, medications that we take, that can be kind of the thing that ultimately the hip fracture is kind of the end part of it. Some of the more, other things that we're looking at with regarding hip fractures, we want to prevent them if we can, and that's why we give talks like this, because of the high morbidity with them. And one of the more recent statistics I kind of heard of, a hip fracture can be just as physiologically damaging for someone as a heart attack. And that's the medical and physiologic toll that a hip fracture plays on. So not insignificant at all. Yes, ma'am?
Is it true that when a person